everyone. Welcome to Triple Track's podcast. We're really happy to be with you today. My name is Jen Dorsey. I'm a licensed therapist practicing in the addiction treatment field for the last 26 years.
And I'm Dr. George Kolodner, an addiction psychiatrist who's the medical director at Triple Track.
Triple Track is an outpatient treatment program. We specialize in treating people who struggle with nicotine use disorder, whether that's smoking, vaping, or all forms of nicotine. And today we are going to focus specifically on medication for helping people stop using nicotine. So I'm going to turn it over to Dr. Kolodner to get us started talking about Chantix.
So Chantix is the center of the medication protocols that we use, but it is not the only medication that we use. One of the principles that we follow in our use of medication is to follow the same kinds of procedures that we did in the treatment of all other substance use disorders, which is to use the medication in proper doses, a dose which is high enough to be effective, but not so high as to create side effects, to individualize, because everybody is a little bit different, and also to use it for an extended period of time. And I can explain the reason we do all of that. But basically, that's how we use the medication. And we also use a combination of medications because our goal is to make people as comfortable as possible. Stopping nicotine vaping is so difficult that anything we can do to make it easier, we want to do.
So, George, what exactly is Chantix?
So Chantix is the brand name of a medication that's available now under the name of varenicline.
Good.
And we know exactly how this works. It is a synthetic medication that attaches to the same receptor sites in the brain and the body that nicotine attaches to. Those receptor sites are called the nicotinic acetylcholine receptor sites.
Okay.
And it does two things. It mildly activates those receptor sites. And the effect of that is that it relieves or eliminates withdrawal symptoms, particularly cravings. But it also blocks the receptor site from the action of nicotine. So if people smoke or vape while they're on Chantix, they don't feel the rewarding effect that they typically get. And also, it often spoils the taste of cigarettes in particular.
Yeah, so I think one important differentiation that I think that is sort of in all of this is that Chantix is not nicotine. You're not putting nicotine into your body. It's a totally separate medication.
Absolutely. And therefore, when it comes time to getting off of it, because people do eventually get off of it, there is no withdrawal the way there would be if there was nicotine as part of the medication.
That's an important piece, I think, knowing that. It reminds me the way that you're talking for anyone who might be watching that understands other medication for other addiction, a medication like naltrexone. Is it a little bit like naltrexone, or do you think of it more as something like Suboxone?
It's like naltrexone, the way it is. Naltrexone acts on opioids, but naltrexone doesn't activate the receptor site. It simply blocks it. Therefore, naltrexone cannot reduce withdrawal symptoms from opioid.
I see.
It blocks the effect very well. And that's why Chantix is so unique, that it can both relieve withdrawal and block use. But unlike buprenorphine, also known as Suboxone, which is an opioid, it doesn't have an active ingredient which causes withdrawal when it's stopped.
So, George, how is Chantix similar or different from things like nicotine gum or patches that people are pretty familiar with?
Well, one of the basic differences is it doesn't contain nicotine.
No.
But we often use it in combination with nicotine patches, gum, and lozenges, because the Chantix takes a while to build up in people's system. And while it's building up, best practices are to combine it with a patch. And if that's not enough, to have people use gum or lozenges as so-called rescue medications, at least for the beginning stage of using a Chantix, because over time, the Chantix will block the nicotine in the nicotine patch, gum, and lozenges, just like it blocks it in the cigarettes or vapes.
And so given you can take Chantix along with other sort of forms of NRT, nicotine replacement therapy, what about using actual nicotine, like vaping, smoking, dipping? Can you, how does that work when you're taking Chantix? Where does the quitting part come in?
Well, if you smoke or vape or use other forms of nicotine while you're using Chantix, there's nothing dangerous about that.
Okay.
So that's not something to worry about.
Mm-hmm.
The way we used to use Chantix, the timing was to pick a quit date and then back figure the timing for the starting the Chantix based on the quit date, because you have to build the dose up over a period of a couple of weeks. But these days, we found it's more effective to, in fact, start the Chantix and have people feel the effect of it. And once they know it's working, it is psychologically easier for them to pick a quit date. Someone who's been using nicotine for as many years as most of our patients have, find it very frightening, the being without it. And one way to reduce that fear, it seems unimaginable to them that they could live without it. And one way to reduce that fear is to have them experience the impact of the Chantix.
Yeah, I think that has been, as a therapist, a non-medical person, watching our patients start taking Chantix, also known as varenicline, and experience a reduction in that desire, that constant, I want to smoke, I want to vape, to have that lesson for them is, feels, I think a lot of them talk about it as like a miracle. They can't believe it. They never thought it would be possible. And it really does make setting that quit date so much more realistic for them. It's pretty amazing. But I know a huge fear for most people is, what are the side effects of taking a Chantix?
Right. And one reason that Chantix has not been more widely used is that there was misinformation about Chantix. After it was released, there was a concern that it caused depression, suicidal depression, or psychosis. And there were very rigorous studies done to demonstrate that that was not the case. But even after it was disproven, the reputation has stayed on. And we certainly see a lot of people in our program who are hesitant because they still believe that old misinformation. But like any medication, there are side effects. The most common side effect is nausea, which is why we urge people to take the medication with food. And it also creates very vivid dreams for some people. And again, with nausea and dreams, some people have none of those symptoms. There are rare occasions when the vivid dreams become nightmares, and that can be a reason to stop the medication or to change the dose, because a lot of the side effects are dose related, and that's where the individualization is so important.
So the big takeaway, because it's a big myth, and if we could get rid of one myth that's been circulating in the world of nicotine users and their treating doctors, it's that Chantix does not cause psychosis, does not cause depression, does not cause suicidality.
Exactly.
Yeah. And the side effects are pretty low. But I think this this is where we really try to, you in particular, really try to individualize how we use medication in somebody's process of quitting and staying quit. Because I'm thinking about two different patients we've worked with. One who at 0.25, so half of a half tab, essentially a quarter tab, gets the effects of Chantix, whereas I know we've worked with other folks who have, 3 milligrams. So kind of over the typical full dose, and don't really feel like they notice the effects until they actually quit. So like really varying experience.
Right. Most people respond to the standard dose of 2 milligrams a day, but there are people at both extremes, and it's important to be able to accommodate the people who are very sensitive or very insensitive, rather than just dismiss the medication because the standard dose doesn't work for them.
Okay. Reminder, everyone, this is Triple Track Smoking and Vaping Cessation, a fully virtual program that helps people quit nicotine for good. You can learn more at our website, tripletrack.com. All right, welcome back, everyone. Just a reminder about what we've talked about so far, and George, you can insert anything that I might miss. We talked about Chantix is really the number one medication that we have available to us for helping people stop, and that's because it both virtually reduces withdrawal symptoms to nothing and really, really helps with those cravings that come after somebody puts down their actual use of nicotine. We talked a little bit about side effects, knowing that those are different for everybody. Most people just have some general nausea in the beginning, which is managed by taking their medication with food, like most medications. We know that Chantix is very different from nicotine replacement therapy, meaning patches or gum or lozenges, because there is no nicotine in Chantix, which is one of the reasons why you can stop taking it and there's no withdrawal whatsoever. And we also busted that myth that is kind of still out there that Chantix causes psychosis, suicidality, or depression. And we know that it absolutely does not. It does not have any impact on somebody from that perspective. Anything you would add in our summary before we keep going?
No, just that many of our patients are reluctant to take medication for this. And it is true that some people are able to stop and stay stopped without medication, but the percentage is very, very low. And there's no downside to using medication to get on.
Yeah, and I think a big question, because we've been talking about how great Chantix is for those people who can and want to take it. It's certainly not a requirement. But if Chantix is so great, why is the program not just Chantix?
Well, with any addiction, there's no addiction that from which people can recover with just a medication.
Right.
That you really need the other elements of treatment that we can talk about in other podcasts, but that's why we call ourselves Triple Track, because the medication is just one of those tracks. The psychological and social are the other tracks that are essential if somebody's going to successfully recover.
Yeah, I hear you say this all the time. It's one of my favorite things that you say, is that we start with the medical approach so that we can reduce the withdrawal and cravings, so that somebody can then focus on the underlying habit and psychological and emotional components of nicotine addiction. That we really have to get that biological or physiological part worked out first.
Right. And these days, because smoking is so stigmatized, there's a lot of isolation.
Mm-hmm.
Reducing isolation is is characteristic of addictions to substance. Part of recovery is breaking out of that isolation, connecting with other people in an open and honest world.
So how long typically do you think, or how long is it recommended that people take Chantix, also known as varenicline?
Well, again, that's one way in which we're different. When you say it's recommended, the standard recommendation is just to take it for a few months, not longer than 6 months. And in addiction treatment in general, if you have an effective medication, you generally want people to stay on it for a year. And that's what we recommend to patients, to stay on it for a year.
Yeah, this was something I think I learned from you maybe 15 years ago. That the changing of the seasons is really important. Going in when you are doing something new, when you've stopped, something that has been a massive part of your life, like smoking, vaping, or other substances, certainly, going through each of the 4 seasons, having an opportunity to go, we're heading into fall. So there's all these connections emotionally and psychologically to what it means to be getting colder, having to go outside to smoke or vape, having to, how do I now make sure I cover up the smell if I'm not driving with my windows down all the time because it's no longer summer anymore, and kind of going through the changing of the seasons. I think the importance of that is it's not about quitting. Quitting, as hard as it is really just that really first step. It's really what we're really interested in, is helping people stay quit. And for most of our patients, they have quit before many times.
Right. And the first step is getting through the withdrawal symptoms. Mm-hmm. Most do not get through the withdrawal symptoms. And that's where the medication can be so critically important in the quitting phase. The staying quit phase involves dealing with day-to-day stresses that people have come to rely on nicotine to help them through. And it's figuring out ways to deal with those stresses. Can be done, but generally people need ongoing support during those times, at least for the first year, until they get more practiced at those skills.
So in essence, using Chantix a little bit like a relapse prevention tool.
Absolutely. It's a terrific relapse prevention.
And how would you say that one could use Chantix like a relapse? How specifically have you done that with our patients?
Well, generally we urge people to just take it on a daily basis, automatically. Mm-hmm. But once people have stopped taking it, if they see a time coming up which is going to be a challenge for them, be particularly stressful, or a time where recreationally nicotine was a part of their of that event in the past, they can resume the Chantix for a period of time, preventively, rather than wait to relapse.
Great. That's it for today's episode. Thanks for being here, and we'll see you next time.